Okay, this doctor asked me, I don't know where to start, which source should I use? So let's go from beginning. So ideally, starting should be based on your strengths and weakness. So anything you do, you need to, let's say you're starting a business. You need to know, what do I know about starting a business? What do I don't know about starting a business? So this is the most important thing, is what are my strengths? What are my weakness? Then you have to map out a study plan. Okay, so these are all my strengths. These are all my weakness. Now you are here and this is pass. Okay, so you have lots of doubts, you have time management problems. Let's say you don't have frameworks, you don't know the guidelines, you have knowledge gaps. So this is your bridge, and your plan now is to map out how you go from here to pass. See, ultimately we need to pass. That's why you do any exam preparation, you appear in any exam, is pass. You're not going there for fun. So this is where I would start. This is very, very simple, I know, but this is what I teach my one-on-one clients. When they say, Dr. Talari, I'm struggling, I will ask them, okay, this is what I do. I usually do 5 role plays with them, and I figure out what are all the problems they have. Let's say 1, 2, 3, 4, 5, 6, 7. Most of the time the problems are time management, fear or lack of confidence, then fear of missing a diagnosis or knowledge gaps, then it is not having a structure, not knowing guidelines, and not able to understand the exam format. So these are only few, but this is something I learned after teaching thousands of doctors, like preparing for the clinical exam, medical students. So then I map out a plan for them. I will say, okay, so in 8 weeks, this is what you should do. Week 1, week 2, you do this, week 3, you do this, week 4, then I usually after 4 weeks, every week I do a check-in. I'll make sure they're working on it, and at 4 weeks I will do 5 more role plays. Then surely I will know if these guys are working on it, if they're serious. If they're not serious, then I'm going to be very angry. I push the students. If they're paying me money, I take responsibility that they have to pass. I do 5 more role plays, because one role play, you will not know exactly what it is. So I usually go 5, 5, 5, total of 15 role plays. And at the end of 8 weeks, I usually do another 5 role plays. So this involves lots of effort, time, resources, planning, and customized plans. So I put a lot of time, effort into this. So I take this seriously. Yes, I charge money for this. This is not a free thing, but I'm giving you this strategy because not everyone might need this. Some of you are smart enough to figure out what to do and how to be successful. And some of you might not afford to do this. So I wanted to genuinely help you guys pass the exam. So, and be good clinicians. Ultimately, you want to be a good clinician. Passing the exam is nothing. You want to be a good doctor where your patients will respect you, love you. They will come and give you money. I'm double booked. I have to say no to patients, because when you are genuine, when you really care for the patient, when you tell the patient that you know what you're talking, people will come to you, love you, see you, and they don't want to see other doctors. They become fans. Ultimately, you want to have patients as your fans. Like you want them to love you, and you want them to be upset when they can't see you. Like patients tell me, Dr. Talari, we can't see you. We have to see this doctor. Now we have to come and see you again. For some reason, people love to see me. Maybe it's the personality. I ask them when they say that, I'll say, what is it you like? Because I wanted to know what my strengths and my weakness are. Always I go back to the same thing. What are my strengths and weakness? I want to get better as well. Every day I want to be better. So whether it's, my speed, whether it's empathy, time management, I try to work on it every day, and you should do the same as well. So coming to that, then sources. That's the 20,000 foot view. But if you want, you can book one-on-one calls with me as well, or you can just book one call. Yes, it'll cost money because my time is very valuable. If I go and work in the clinic, I make a lot of money in Australia. So obviously I respect my time as well. But I do lots of free videos because ultimately I want people to be benefited. I don't do this for money. I make money as a doctor. I work full time, but some people wanted that attention because they still went through the courses. They went through this group coaching program, but they still want some extra help. They are the ones who can afford money, who will do one-on-one coaching, and it's not cheap, but they are the ones I'm talking about. Okay, so sources. This is the second thing. Usually I read the standard clinical books. Unfortunately, these books don't teach you the strategies. So first source I would advise you guys is join the group. The group, it's a free group. There is so much material there which I can easily charge you for. Like this strategy which I'm teaching here, I can charge you money for this. This video I can charge you money. Even if I charge you $1, I'm sure if you're watching till now, you see value. That's why you're actually watching this. I can charge you money for just this video because this is something I figured out by reading books. I read books on time management, memory, productivity, and a lot of things, and I implemented all those things into education, into my clinical practice. So what all I'm teaching is what I do. I don't read something and teach, because whatever I'm doing in clinical practice or real world is what I teach the doctors and medical students. So material, you can join the free group. You can't just get it like that. You need to show proof that you are a medical student, or you are preparing for USMLE Step 2 CS or PLAB or AMC clinical or any clinical exam on planet Earth. All I need is proof that you are not a scammer, because scammers come into groups and they annoy the hell out of you and other students as well. So I need proof that you are a genuine medical student. So if you have it, I will give you access, and you can actually get so much free value, because some of the things that are there in the group are paid content. People pay for it. So you get to get value from the group. There are lots of material like mind maps. I post everything inside, which I can't post too much on the YouTube and things, but there are lots of material in there, all for free. And if you like the way I teach, if you like my style, there is a weekly coaching program as well. So you pay on a weekly basis and you get access to everything. If you don't want to, then you don't have access. So when we do this weekly coaching program, we have 3 calls a week where I teach everything from beginning to end, like from history taking, thinking, how you're reading a scenario, what to do once you go inside. I teach the formula, the strategy. We have Q&A, and we do live role plays, and you get access to all my courses. You get access to all the role play recordings. So you learn from other people's mistakes. So this is the best thing I can do, and I made it so affordable. And I want you to get this opportunity to know who I am, know my style. And if you believe that it's something you wanted to do, I might put a link under this as well. That's a weekly coaching program. I've not gone live yet, but that's something I will be posting in the group. So to get access to the group, dr.talari.education@gmail.com. Okay, so you need to send an email with a proof that you are a medical student or a doctor, and I will give you access to the group. And you go in there, you watch out all the videos, get the mind maps, get the PDFs, And if you believe that yes, group coaching is for you, then you can actually apply for it. It will be available there, or I might put a link under this video as well. So I don't know, at this moment it's not live yet, so I don't know. So that's the plan. I wish you all the best, but this strategy is the same. I wish you all the best, and make sure you use this. Work on your strengths, work on your weakness, get the clinical books. It depends on the country. First aid books are good. If you're in Australia, John Murtha is a very good book. But I would say all these books don't teach you that time-saving techniques, the mnemonics, the frameworks, which is what I teach in my courses and the group coaching program. So I'm 100% confident they will help you in your clinical exam and make you a better clinician. My goal is to help as many medical students as possible be better clinicians, to as many international medical graduates as possible to be better clinicians. So I wish you all the best. If you like what I'm doing, watch all the videos in the YouTube, Facebook, Instagram, wherever you get access to this, and flick an email. I will add you to the group where you get more free training and material and everything. With that, I will see you inside the group.